Good morning, everybody, and welcome to the 2022 end of year graduation, as well as the student project presentations. And first up is going to be Jack. So go ahead, Jack.
Okay. Good morning, everybody. My name is Jack Cooper. I'm a third year student here, and I'm going to talk to you a little bit about homeopathy for surgical recovery. First, just briefly, just a little bit about homeopathy. Homeopathic medicine or homeopathy is a holistic or whole system of treatment that originated in the late 18th century. Obviously, our founder was Samuel Hahnemann, and he used the Latin phrase similia similibus currentur, or let like be cured with like, to summarize the underlying principles of his system. He experimented with quinine and he developed symptoms resembling malaria. He concluded that the curative powers of the substance were derived from its ability to produce symptoms resembling those of its target disease. That's really kind of the key here. It is the basic principle law of homeopathics. It states that medicine can produce symptoms in a healthy person will cure the same symptoms in a sick person. Homeopathy recognizes every person is unique. The practitioner needs to study the patient physically, mentally, and emotionally, the lifestyle, the environment, family, even the history and spiritual aspects as applicable. This facet of homeopathy is termed the constitution. Symptoms are not viewed as something that is wrong, but rather something that must be set right, and signs that the body is attempting to heal itself. The purpose of homeopathy is the restoration of the body to be restored to homeostasis, or the healthy balance, which is actually considered to be its natural state. Okay, so a little bit about surgery. So last year at this time, 2 days after I graduated, and I was kind of riding the high of scoring well on the exams and getting a little break, I got a call from my dermatologist who told me that I had melanoma on my left cheek and I needed surgery. So it's also, I guess we could subtitle this as how I spent my summer vacation as well. The surgical phases that I went through, of course, I was kind of shocked and surprised when I heard the news. I was fearful. Then we actually went into the procedures. There was a lot of trauma, there was a lot of swelling, and there was eventually a recovery phase. So as you can see here, that's pretty much how I looked when I got the news on the phone. Some of the remedies that I looked at this moment in time were arnica montana for mental and emotional shock. And of course, I'm kind of big on there's really nothing wrong with me. So I looked closely at that. Carcinosin, of course, for the fear of cancer or incurable disease, worrying about health. Very emotionally closed, complaints from anticipation. What I settled on was aconitum. And of course, that's the state of fear, anxiety, and shock, the fear of going to the doctor, and the fear of the future. And I will tell you guys, it really did help calm me down. And it allowed me to have clear thought instead of just feeling like I was spinning or like the kid in the picture. So I went in and my surgery was basically in 2 phases. You can see here, this is actually after they had done the final surgery, but the initial surgery was, you can see here, a dime. That's about the size of the hole that they cut in my cheek. So then they had to send it off to the lab and to make sure that there was no cancer in the margins. And so I went home with basically a sponge in a hole this big. What they then did is they cut a flap and they pulled the skin over. So as you can see in my face here, I have like a little mini facelift here. And it's from actually pulling the skin on my cheek over to cover. Okay. Obviously, you can see from the picture, there was a lot of swelling. I'm not actually sneering for the camera. So for trauma and swelling, I went to the tried and true Arnica montana, bruising and swelling. And I will tell you too, guys, that between the two procedures, when I went in for the final surgery, the surgeon was actually surprised. He told me, he said, "You should have a black eye. You should be swollen." And he said, "You're really not." You can tell in the picture, although there is swelling here from just having my face yanked around and stitched shut. But you can tell that mostly around here, it's really not all that bad. Okay. Another interesting thought was the surgeon himself was trained in South Africa and knew about homeopathy. He was really curious about what I was going to do and what I've been doing. And he knew the actions of all the remedies. I thought it was really cool. Calendula officinalis, I started using immediately after I was all stitched up, right? It's a healing agent. It's for wounds, it's for cuts. It helps prevent scar tissue. It is an herbal antiseptic, and it is for pains after surgery. I also looked at graphites naturalis or graphite, which of course has cancer, scarring, skin disorder, aids in the absorption of scar tissue. And for the homeopaths in the group, which I think is just about everybody, I did look a lot in repertory as well under cuts, incisions, surgeries, lacerations, fear of surgeries, fear of doctors. I looked at cicatrices, kind of the cool word for scarring. I also looked at nerve recovery, skin recovery, healing of wounds, infected wounds, general wounds, lacerations, et cetera, et cetera. Okay, so this is actually about 10 days later, and they've just removed the stitches. So you guys can actually see it's healing up really well. The swelling's already started to go down. The arnica's doing its thing. They were really impressed when they took the stitches out. They said, "You're healing amazingly well." And I told them, I said, "Well, thanks to graphite and thanks to calendula." Now, on the potencies of calendula and graphite, I did go as high as 200 a few times, and I would take maybe 200 weekly, but I was doing 30C at least daily. Okay, and that's because it was really acute, really painful, and really swollen. As I got into the recovery phases, I started to taper back, knowing that it was more for a long haul. And I started to take in these remedies in different times, different places. I used 30C, and I would use 30C weekly, depending. So, oops, sorry about that. Okay, so for the deeper healing after arnica had done its thing, I went to Bellus perennis, which is for bruises, cancer, injury, swelling, trauma, tumors at deeper levels. I also went to thiosinum, which assists in dissolving keloids and scar tissue, wounds that are slow to heal and have scarring. And I did have some nerve damage here as well, because obviously they yanked everything over and this was pretty numb. So I did look at hypericum, and I took hypericum. And hypericum, of course, relates to injuries, lacerations, and injuries to nerves, pains from surgical cuts used in acute traumas. Of course, I wanted to cite the works that I actually use, which are kind of two of my go-tos for materias. First is Nature's Materia Medica with Robin Murphy, Prisma with Franz Vermeulen, and of course, all my class notes from school. That's kind of it, guys. Are there any questions? Get timed out this time. That's kind of...
You didn't, and I do have my little timer going here. Well done, Jack.
Thank you.
Let me just stop the timer. That was really great, really, really fantastic. It was a good reminder as well about thiosimazine, because it's a remedy we actually don't teach in class, but it's such a great remedy to help heal with scarring. So let's give Jack some love. Well done.
This really wonderful homeopath named Avghi
Thanks for sharing your story.
did that to me.
Did I tell you about that remedy, Jack?
You did. You
Yes.
did. And then I went and dug into it and I went, oh, spot on. Let's go for it.
Yeah. Good, good. Yes. I actually had created over the years a couple of combo remedies. I know they're combo remedies, I shouldn't, but they're basically for people that have surgery. Um, One is called pain and inflammation, and the other one is a scar formula. And I do have a couple of combos of different remedies, and one of the, the thiocymazine is actually in one of those because it saves patients taking, oh, I'm going to give you this, this, and this, so take this one at this time. And I'm like, oh, let me just combine and make it easy. So it's more of like a first aid acute, but well done, Jack. That was so informative and really great. Thank you.